Moving on, we are going to move to Hunter Griffin, who is the policy analyst at New Jersey Business and Industry Association. And he works along with Nikki Sandelier, who most of you might know. She's the director of economic and policy research at the NJBIA. And both of them have done industry series studies, and they have found some amazing findings. So Hunter will be sharing that very briefly with us today about their study. Hunter?
Yeah, thank you so much for having me today, and thank you for the speakers who have gone before me. I have to start, I promised Nikki I would start by apologizing on her behalf. She really wanted to be here, but had a last-minute television interview come up, and she couldn't really move that around. But I assure you, I'm the next best thing. I worked with Nikki on this study since last winter, and throughout the summer, we, spent a lot of time together pulling our hair out as we were finalizing all of these studies. So the Future of Work study, some of you might know, was a 7-industry study that we embarked on to identify the workforce needs of the present and the future for New Jersey, and identify some of the industry challenges and industry opportunities. So I'll hop right into it. Obviously, we're going today on the industry study for health services. But sort of an informal way to frame this, I guess, would be to say that it's not surprising, but a lot of the industries that we talked to had a lot of the same themes running through them that they felt were shaping their industry and were going to continue to shape their industry. Clearly on this slide, you see we're going to talk a little bit about technology and artificial intelligence. That's a big theme throughout all of the industries. But so is the idea of how the aging baby boom generation, as they age into retirement, how is that going to affect each industry, as well as the idea that we need to sort of move past the stigma around not going to a 4-year university right out of high school. A lot of the people that we spoke to felt that that was really important. So we'll launch right into this. So we're going to start with some changing industry dynamics and emerging trends. So a lot of the leaders that we talked to felt that the continued integration and advancement in technologies and artificial intelligence in this industry was really going to change the industry, as it allowed for more accurate diagnoses, making healthcare more accessible, in some cases more affordable, and allowing for better integration of delivery methods. And then if you could go to the next slide. Thank you. So then some industry opportunities. We're seeing this already because of the COVID-19 pandemic. The adoption of telemedicine and telehealth. I guess, in this case, it's been sort of because in some cases it was the best game in town, but that is likely something to be something that will continue to shape the industry, as it allows patients to have increased access to their healthcare professionals. Next generation sequencing, which identifies at-risk populations and can target therapies better to patients in high demand. 3D printing devices can lower costs and allow for creation of highly customized medical technology products, and those products can be better tailored to meet the needs of specific patients. Artificial intelligence and technology, we're coming back to that. These devices have the ability to think and complete tasks previously performed by humans with greater speed, accuracy, and with lower resource utilization. Immunotherapies and point-of-care diagnostics are advancing, and the senior citizen population is expanding. Again, the idea that, as we see the baby boom generation age into retirement, that will be an opportunity for this industry. If you could go to the next slide, please. Thank you. So industry challenges, the ability to find a qualified workforce today in certain sectors, and we'll touch on that a little bit later. Maintaining privacy of confidential patient information from security breaches and hackers, that cybersecurity component. And then the ability to connect multiple pieces of technology or artificial intelligence together. So sort of this idea that we have a lot of this technology that can do these great things, but in some areas, they're not as interconnected as we would like them to be. The uncertain outlook of the Affordable Care Act, ACA participants who would otherwise not have health insurance, leads to a reduction in overhead associated with hospitalized uninsured patients. The increase in high deductible plans has led to greater volatility with some patients opting to wait until the end of the year for treatments rather than the beginning of the year when their deductibles haven't been met. And then employee burnout due to stress, exhaustion, and trauma. This was certainly one we heard from several people that this is a serious concern for some in the industry. So current workforce needs that impact the jobs of tomorrow. So right now, we're really seeing in-demand careers such as registered nurses, nurse practitioners, licensed practical nurses, direct care workers such as home health aides, and certified nursing assistants, nurse managers, and office directors. I guess you could say that there was a slight disconnect here between where some people felt that the industry was moving in the future, 10 years down the road, and where it is right now, because these careers were heavily in demand at the present. And then if you could go to the next slide. Thank you. So then preparing the workforce pipeline for the jobs of the future, we tried to we used our business leaders to help us identify some important skill sets that it was important for individuals going into the industry and individuals currently in the industry to have. So we divide those up into hard skills and essential career attributes, which are also known as soft skills. So for hard skills, big data and analytics, cybersecurity and information technology, 3D scanning and printing, robotics, nanotechnology, simulation and virtual reality. Essential career attributes: emotional intelligence, critical thinking skills, decision-making skills, adaptability, leadership, motivation, and self-awareness. And if you go and look at any of our other industry studies, you will find a lot of overlap in these skill sets, whether they're the hard skill sets or the so-called soft skill sets. And if you could go to the next slide, please. So this is the last one, tying it all together, offering some solutions that we can work on together, whether it's academia, business, or government. So, as I mentioned at the top of the presentation, it's really important to change the societal misconception that you need a 4-year degree to have a career in the health services industry. Many jobs require VOTEC training and not just a 4-year degree. As I mentioned, I believe home health aides is one example, as you see in the next bullet point. Promoting CNA and HHA level jobs is a noble career pathway. Create more CNA and registered nursing schools in the state to help attract more students in the field. Promote lifelong learning and certifications to help those in the field work their way up the ladder. Create better means of communication between industry, government, and institutions to clearly articulate industry needs and training requirements. And then finally, recognizing the advancing technologies in the industry and incorporate the future of work hard skill sets into all levels of health service careers, rather than just those highly skilled career pathways. It's important for anyone in the industry to understand or have a degree of comfort with some of those hard skill sets, especially when it comes to being able to utilize and work with some of that important technology. And that is all.